I'm Wendell Worthington, Statesville, North Carolina, and I've been seeing Dr. Baker approximately 2 years now. He has done wonders with my legs. I've had no trouble with my legs since he did procedures on them last year, and very happy with it. Well, many years ago I had a broken left leg and it clotted on me, and then I had trouble with ulcers forming on the leg, and the physicians here would work on the ulcer, get the ulcer cleared up. Then it seemed like 4 or 5 months later I'd have another ulcer, and they would treat the ulcers, and a doctor at the wound center about 2 years ago said, "Wendell, it looks like the ulcers are falling in a row right where the veins are." And that at that point it made sense. He said it's due to soaking in the veins, and he recommended a clinic in Winston-Salem, Dr. Baker. And the girls there at the office at the wound center was able to make an appointment for me. And that's how I started with the wound clinic in Winston. I mean, the vein clinic in Winston.
I'm Doris Worthington. I'm Wendell's wife, and I went with him each time that he had a procedure at the vein clinic. And it was summertime, and my legs were bare, and it was very obvious that I had some problems with my veins. And after he had finished with Wendell, he said, "Do you want us to let's look at your legs?" And I said, "No, I don't need that. I'm going to be all right. I don't think mine are bad enough that it would be covered by insurance." And he said, "Let's do an ultrasound and let me decide what needs to be done, and I'll worry about the insurance and you get your legs healthy." And so we started, the January 30th, I think, was my first procedure, and it has been very successful. I'm still in the process now doing the sclerotherapy, and it's just been a joy to be with the people on that staff. They're the most loving, kind, welcoming. You never have to wait for very long, and they got candy, and it's almost a fun place to go.
Dr. Baker explains everything he does before he does. If there's going to be an injection made, he says, "I'm getting ready to make an injection into your leg," and he talks you through exactly what he's doing, so you know what's happening, and it's well worth the time and effort. Very comfortable.
My granddaughter had a YouTube video that her voice teacher had done, and while I was in surgery, I was telling Dr. Baker about her singing on YouTube, and Amanda said, "How do you spell her name?" She pulled it up, and so while I'm having surgery on my legs, we're listening to my granddaughter sing in the operating room. So it's always been very comfortable. He dispels any fear that you might have because he's such a gentle, kind man. He really is. When I was on my feet a lot, my legs would bother me, and I found out
burning.
Yeah, it would like burning in my lower legs. I think that people have heard so much about, "Oh, insurance won't cover this because it's all cosmetic," and the thing is that when you have that problem, there's a deeper problem than just what you see on the surface, and the pooling of blood, if it's left that way, can cause ulcers like Wendell had. And I didn't want it to get that bad. It destroys your skin on the surface in his case, and that's why the skin was so thin that it was so easy for a little ulcer to start because it didn't have the
Well, it
protection.
starts from the inside where the blood is pooled over a period of time with
But I mean, the
oxygen in
breakout.
the blood, and it breaks from the inside out, and it's deep. And I never realized that's the way it did it until Dr. Baker explained it to me. And said we can get the blood to stop pooling by closing the veins. You should be okay as long as you keep it cream on your legs so that you don't get dried shafted, especially in the wintertime, and have a break in the skin. So.
It's the valves in the vein that are not closing properly, and so there's nothing to pump blood out of your legs except the exercise, the muscle action. And so he explained to us that when the valve leaks, it pumps that blood up when you're moving, and then it goes back down, it leaks back down around your ankles. And this had gone on with Wendell so long that the ankle was very discolored, really dark, almost black looking around his ankle. And now there's still the scarring from what happened to him, but you can see pink underneath that now, and you didn't used to. So we know that that's good blood. Yeah, it's getting good blood flow. Very much we would recommend Dr. Baker, very much.
We would, and we have.
Yes, yes. They care. I think that's the thing. They really care. They're not in it for the let's see how many patients I can see and how much money I can make. They really genuinely care about the people that they're treating. And you feel like you're the only one.
Well, when he's working on you, you are the only one.
That's right.